Our helpline counselors are in the process of helping a Springfield woman who's mentally ill and diabetic. She had to have all of her teeth pulled in June, and because of the budget cut, she is no longer able to get dentures. Her doctor has directly warned us that this threatens her health, and she may die without being able to have dentures.
It's not only dental, it's medical. It affects your medical health along with your oral health. This isn't reinstated. I'm going to lose my front teeth. And, you know, all my other medical problems, my teeth mean more to me than any other one of the serious ones I have.
The proposed cuts to adult dental care will have a negative impact on the health of over 700,000 Mass Health recipients, and a significant proportion of these individuals reside in the city of Boston. Indeed, 1 out of every 5 Boston adults is covered by Mass Health. We know from research in clinical care that oral health is critical to overall health, and that poor oral health increases the risk for heart disease, as you heard earlier, complications from diabetes and HIV, as well as low birth weight and premature infants.
One 44-year-old woman with no teeth will not be able to obtain the denture she was promptly expecting following her April 2010 extractions. She wears a mask when she leaves her home, and she was embarrassed to visit her daughter's school. I had to call her yesterday and tell her I exhausted all options, and there was nothing I could do beyond refer her to a community health center, while she will likely wait many months for an initial appointment. Nationally, more than 51 million school hours and 164 million work hours are lost each year due to dental-related illnesses.
Over the past year, I volunteered with the Red Cross and the Nutrition Works program that's done through the Boston Living Center, which is a community resource that I take part of. And we help people who are diagnosed with HIV and AIDS get nutritional groceries above and beyond what other food banks are giving, because we realize the direct correlation with nutrition and overall health. And a few people have actually come through and have given the fresh produce back because they don't have the ability to chew.
You all know the basic facts. Restorative dental services prevent simple dental problems from becoming chronic or life-threatening issues. Without timely access to these services, easily treated dental diseases can result in infections that could spread throughout the body, potentially devastating consequences. Moreover, not only will the cuts in dental benefits have a major negative impact on the lives of over 700,000 residents in the Commonwealth, whatever cost savings are anticipated may be illusory.
I have to say I'm particularly confused at the continued practice of artificially separating oral health from other medical services. I'll be honest and say I'm obsessed with oral health. I worry about infection, I worry about the loss of my teeth, and the impact it will have on my ability to function using my mouth stick as I rely on it to access my telephone, computer, light switches, etc. This is the stick. I can't imagine doing this without my teeth. I worry about increased infections that may lead to hospitalization, that may jeopardize my independence.
In the earlier 9C cuts of 2002, services were retained by special circumstance or population. Ultimately, all adult dental services were restored. In the aftermath, Mass Health had to deal with the effects of years of dental neglect and loss of confidence. For persons living with HIV or who are otherwise medically complex, sound oral health affect their ability to adhere to medication regimens, which often rely on food intake to either be effective or to be tolerated.
I'm here today on behalf of people like myself who have HIV. I just couldn't imagine when I got the letter last May to say that I would no longer be covered for mental health. Who could have made a decision like that about my health without informing me?
I'm here today on behalf of the 52 community health centers we represent across the state, 33 of which have dental operations in 48 different locations. Our centers saw over 130,000 patients and performed around 381,000 patient visits in the past year alone. However, with the new restructuring of Mass Health Adult Dental, our centers are being inundated with new patients no longer able to see their private providers for restorative care. We are concerned for the patients we might not be reaching. Just recently, the Division of Health and Finance published a report stating that preventable hospitalizations accounted for 13% of inpatient admissions among adults and accounted for an estimated $639 million in hospital costs in 2008.
I stay at Pine Street Inn, the local homeless shelter. Recently, I had my teeth stolen from me. Not my bottom teeth, I have all those still, but I had my upper teeth stolen from me. First preventative of my care isn't just being popped full of pills there and stuff, it's making sure that all my care is met. And the biggest one is dental care.
I mean, how do you leave the house without your teeth in? How do you talk to somebody? How do you look for a job? I mean, does anybody here want to go to a restaurant and have the waitress without any teeth take your order? I mean, even at Burger King, if somebody walked up to you with no teeth and asked for your order, you know?
For dentures, the transition procedure is just too rigid. The transition was if people had gotten authorization in advance and the work had started before July 1, they could get it completed. But request for the denture didn't happen until after. I think the transition rule is too rigid. People had healthy teeth taken out of their mouths in anticipation of dentures and then find they don't meet the terms of your current transition procedure. That's really unreasonable and inhumane. They would have been better off keeping their healthy teeth. They had them removed in anticipation of dentures.
A little less than a year ago, I became a victim of another sort. And through that encounter, was beaten very badly. I was 40 pounds heavier because I could choose what I wanted to dine on. I have difficulty chewing now. I have 6 loose teeth in the front of my mouth. I have 4 loose teeth on either side. The back of my mouth. I'm not a very vain person, but I love to smile.
Currently 6 months pregnant. I do plan on breastfeeding, and I wonder, how am I supposed to properly breastfeed my child, give her the nutrition that she needs, if I can't get the nutrition that I need?